Good evening, good afternoon, good morning, wherever you are tuning in from. Welcome to Facebook's Neurology for Vets webinar series, sponsored by Hallmark Advanced Imaging. Thank you very much to Hallmark for sponsoring these webinars. We are looking like we are missing Laurent, but don't worry, he is here. He's in the background. I think it's because he's already had 2 glasses of wine that he's decided to go dark on us. But fear not, we still have him here. But we are lucky to have Dr. David Casado here presenting today, and also his mentor. Many people will know the Queen of MRI, Dr. Ines Carrera. Thank you very much for joining us, and thank you, David. I'm going to introduce you to our audience. For any of you tuning in that haven't seen these sessions before, we like to encourage residents in training, people who've just qualified as neurologists or imagers, to present some of their recently published work on neuroimaging. Obviously can be a little bit daunting, but we hopefully provide this platform so that they've got a voice to show how much work that they did and what the results of that work are. So really honoured to have this team here. David, thank you very much again. David graduated from the University of Lyon in Spain in 2012, and after completing a master's degree and working in small animal practices between Spain and Portugal, he moved to the UK in 2016. David worked in a busy first opinion hospital near Bristol before undertaking a rotating internship and a diagnostic imaging internship in different referral centres. Currently, and since 2021, David is working towards a European diploma in small animal diagnostic imaging at Willows Specialist Referrals. So hello to the Willows team there, and no doubt all your colleagues there are tuning in, supporting you here. So hello to them. David enjoys all aspects of diagnostic imaging. He's very interested in research. Today, David's going to present his recently published paper on MRI characteristics of intradural extramedullary intervertebral disc extrusions. So welcome again, David. Thanks for coming. Thanks, Ines, as well, for being here on the team, the panel member. We can allow you to take it away, David, if we can get your presentation up on the screen. This is where Laurent comes in. He is here. There you go. All right. Okay. Take it away. Thank you.
Hi. Good evening, everyone. Could you hear me well? Yeah. I assume so. So good evening, everyone. Thank you, Simon, for the introduction, and thank you all of you for joining us to this online journal club. So I'm going to present our paper, which is titled Magnetic Resonance Imaging Features of Intradural Extramedullary Vertebral Disc Extrusion in 7 cases. This paper has been recently published in Frontiers a couple of weeks ago. So yeah, I'm just gonna crack on. So we know that intervertebral disc disease is the most common spinal cord disease in dogs, and specifically intervertebral disc extrusion is the most common cause of the spinal cord injury in dogs. So a part of the most typical intervertebral disc herniation, other unusual and uncommon types are characterized by different location of material other than extradural. And these include intradural disc herniation, among others, such as acute non-compressive nucleus pulposus extrusion or hydrated nucleus pulposus extrusion, or intradural intramedullary extrusion, intervertebral foraminal extrusion, and intravertebral disc herniation, or mostly commonly known as Schmoll's node. So this type of herniating discs are purely extradural, and it's extremely important to recognize them as such from the point of view of the surgical approach. So before this publication, or before the publication of the present study, just 10 cases were reported in veterinary medicine. So until the publication of our project, the largest study in veterinary medicine included 8 dogs with intradural extramedullary herniation, and of these 8 dogs that were included in the study, the presence of gulf design on MRI was seen just in 3 of them. So in that study, they also looked at the prevalence of this specific type of intervertebral disc herniation among more than 4,000 dogs with herniations, and they found just a 0.5% of prevalence of this unusual intradural extramedullary disc extrusion. So this is the paper that I was talking about, done by Tamura et al. So with regards to human medicine, we know that also intradural extramedullary disc herniation is also very rare. And in human medicine, there are few case reports and review papers, and they stated that roughly there is a prevalence of 0.2 to 2.2% of this type of herniations, and in almost all the cases that have been reported, definitive diagnosis is only achieved intraoperatively. So there is not much information with regards to the imaging diagnosis of this type of herniation, but some studies have identified specific MRI features or MRI characteristics to distinguish intradural from extradural disc extrusion. As we said before, is truly important from the point of view of the surgical approach. And these specific MRI features are the Y sign, the big sign, the crumble appearance of the disc material, and also peripheral enhancement of the disc material. So I'm going to explain briefly, based on human medicine, the 2 most important MRI features for the present study, which are the 2 first ones, so the Y sign and also the big sign. So the Y sign is described as the division of the dura mater and the arachnoid layer. As the latter, so as the arachnoid layer is peeled off from the dura mater by the disc herniation, which occurs between the dura and the arachnoid, and the lesion will be surrounded by CSF signal intensity on MRI. So in these 2 diagrams that we have in this slide, we can see the dura at the bottom here, or in green on the right side, right hand side picture, and then the arachnoid layer on the top. So it would be this dotted line here, or the red line on the right sided image. And in these 2 cases, these 2 diagrams, we can see these 2 layers separated by an intradural disc material, which is displayed in gray. So here, this one is more. I mean, we can see it better in this diagram rather than in this one, but it's just to give us an explanation with a draw. So then this separation between between the layers, between the arachnoid and the dura, gives us this Y shape, and that's what we call, or that's what it's called, Y sign. So these 2 images, 2 sagittal images, are taken from 2 different human patients, which they show an intradural extramedullary disc herniation causing the appearance of a Y sign. So on the left hand side image, we can see the intradural material and then this Y shape here, and which is the Y sign. And on the right image, we can see this dotted line, which is showing us a Y shape, which is the Y sign. Another important MRI feature, at least in human medicine, is the big sign. So this is described as a big-like shaped and sharply marginated lesion. And as you can see in these two transverse images, there is a T2-weighted hypointense sharp lesion with a big shape. So we can see it here, and then in this image we can see it here. This drawing is just to show the big sign again, the big sign appearance. We can see it slightly better on the drawing. So there is this material on the left side of the image, which is displacing the material, the spinal cord to the right. So the objectives of the study were to mainly describe the high field MRI characteristics of surgically confirmed intradural extramedullary disc extrusion in dogs, and also to demonstrate a consistent and a distinctive MRI sign to characterize intradural extramedullary herniations preoperatively in dogs. So our three hypotheses were, first, that the Gulf T sign is not a reliable MRI finding for the diagnosis of intradural extramedullary disc herniation, as previously stated, and that Y sign would be a consistent MRI feature in dogs with this type of herniations. So it was a retrospective, a multi-center and descriptive study in Nature, and patients were included if a complete MRI study was performed, and very important, if a surgical confirmation of intradural extramedullary disc herniation was present. And obviously we excluded dogs that had an incomplete MRI study or clinical data, and ones that they didn't have surgical confirmation. So vertebral canal lesions were classified with regards to its location, differentiating between intradural and extradural. And following the description in veterinary medicine, intradural extramedullary disc extrusion features were examined as Gulf T sign, which is defined as a widening of the subarachnoid space, cranial and caudal to the lesion, or a focal dilation or expansion of the subarachnoid space along the cranial and the caudal margins of the intradural mass lesion. And then adopted from human literature or human medicine, as we said, Y sign and big sign were assessed, as well as peripheral or ring enhancement when contrast was given. So in the results section, so 6 dogs in total met the inclusion criteria, but there were 7 cases in total included in the study, as 1 dog had 2 episodes in different intervertebral disc spaces and at different times. So in all these 7 cases, we found Y sign in all of them, and Gulf T sign it wasn't present in any of the cases included in this study. At the same time, big sign it was seen in more than half of the MRIs evaluated. Additionally, we included 3 dogs. All 3 dogs that were included in the study had contrast media given, and all of them had this peripheral ring contrast enhancement. So in all the dogs that had contrast, we saw this ring enhancement. The location of the intradural extramedullary disc herniation varied between multiple intervertebral disc spaces, so from mid-lumbar to caudal thoracic spine, as you can see on the numbers in the slide. And again, the appearance of the disc material was very variable. So in 4 cases, we described this as homogeneous, while in 3 cases we thought it was heterogeneous. So in the next few slides, I'm going to show you some MRI images from the cases included in the study, and which they display these features, these MRI features. So here we see one case of intradural extramedullary disc herniation at the level of T11 vertebral body. And on the magnified image, we can see some CSF in the caudodorsal and caudoventral aspects of the lesion here. And this is giving us the appearance of a Y shape. And if you remember from the previous slides, this Y shape is given by the separation of the dura and the arachnoid layers, but by this intradural disc material, and consequently we see CSF at the edges of the lesion displayed as a Y shape. So additionally, on this tissue-weighted transverse image, we could appreciate a tissue-weighted hypointense lesion, which is sharply marginated. You can see it here. And this is giving us the big sign, which we explained before, which is just a way to describe the sharpness of the lesion. And I just put the drawing here, the same drawing from before, just to better understand the principle of the big sign and to compare with the MRI. So again, this is the lesion sharply marginated, displaced in the spinal cord to the right. Here is another example of intradural extramedullary disc extrusion, which in this case is caudal to L3, L4 intervertebral disc space, and is characterized by a well-defined tissue-weighted hypointense and rounded lesion, which we can see here. And again, we can see CSF surrounding the lesion, which is giving us the Y shape, which is what we call Y sign. Again, in this dog, we could see a big sign on transverse images, and as you can see in this transverse image, there is a sharply marginated, tissue-weighted, hypointense lesion compressing the spinal cord to the right. And in this slide, I just wanted, so after seeing all the results, with this slide, I just wanted to emphasize the difference or the different MRI appearance between Goff design and Y sign. So on the left, we can see on the left images, sorry, we can see a well-demarcated Goff design of a dog with an extradural disc extrusion. And here you can see the widening of the subarachnoid space, which is tissue-weighted, hyperintense cranial and then caudal to the lesion, and a focal dilation of the subarachnoid space along both edges of the lesion, so around here and then here. These 3 images on the right represent different dogs with intradural extramedullary disc extrusion from our study, which they have obviously intradural extramedullary disc herniation, and none of these cases had Goff design. Instead, we see this tissue-weighted hyperintensity of the CSF within the subarachnoid space, visible as a Y shape, or just being surrounding the lesion, like in this one. Good. So now I just wanted to give you a brief discussion taken from human literature, where it's thought that this type of herniation, it could be triggered by an adherence between the dura mater and the posterior longitudinal ligament, and this adherence, which fixed the dural sac to the dorsal surface of the vertebra, could be caused by different things, such as disc protrusions or previous disc herniation, osteophytes, also inflammatory disc disease, could be also congenital. They found it in some newborn cadavers, and also traumatic irritation or prior or previous surgery. So the principle is that these adhesions will prevent the more common lateral protrusion of the herniating discs, and in these cases, the dura, which is adherent to the posterior longitudinal ligament, may become the path of less resistance to the herniating disc. And then the herniated disc material would perforate easier the annulus fibrosus, the posterior longitudinal ligament, and the dura mater, as if it was one structure, because of these adherences. It's interesting that in people, the dura mater at L4, L5 intervertebral disc space is more firmly attached to the posterior longitudinal ligament anyway, and the annulus fibrosus, which it may explain why this space is the site of predilection for intradural herniation in people with more than 50% of the cases reported occurring at this specific space. In people, ring enhancement is believed to be caused by a reactive inflammatory response with formation of vascular granulation tissue around the chronic herniated material. In contrast, the limited reported acute cases in human medicine, in those cases, the herniated disc material, it hasn't been yet sequestered by any granulation tissue, and has therefore not developed this vascularization surrounding it, which is the basis of the rim enhancement. But now at this point, I think it's important to emphasize that intradural extramedullary disc herniation is a chronic pathology, and that its acute manifestation is rarely reported in the literature. So, for example, in veterinary medicine, just 2 of the 17 cases which have been reported so far, including the cases in this study, where just 2 of them were acute in nature. So all of them, mostly all of them, they were chronic. And at the same time, it's also essential to highlight that even though the pathophysiology of the cause of this type of herniation is chronic, so it's maybe most like a chronic process, this development of adhesions, the herniation itself occurs acutely. So even though it's a chronic process, the herniation event is acute. And now, so as we have been discussing previously, Y sign represents the division between the dura and the arachnoid layers, as the arachnoid is peeled off from the dura by the disc herniation. And from the clinical point of view, we suggest that Y sign might be a truly important MRI feature, at least in high field MRI, and after the results identified in this paper appears that this, as I said, a reliable sign of in dogs of this type of herniation. And it's good to bear in mind that it's easy to identify in two or at least one plane. So normally we see it better on sagittal, but there is also we can depict it also in dorsal plane. Then, as conclusions, so the conclusions that we get or we got from these studies that Y-sign may be a reliable MRI feature for intradural extramedullary disc extrusion in dogs, and that Gulf design is not a consistent MRI characteristic of for intradural extramedullary disc extrusion in dogs. So thank you very much for listening, and I'll be more than happy now to answer any question that you may have. Thank you. Simon?
Simon, you're mute.
I knew I could draw Laurent out there by being on mute. Got him. Okay, so everyone, you did see that Laurent is still alive. People have been worried. Yeah, sorry about that. Thank you very much, David, for that. A very eloquent presentation. We really liked that. It was excellent. And we need to stress from our point of view, from the neurology side of things, that development of these characteristics on imaging is so important, because we need to know what to expect at the time of surgery, and foundational studies like this telling us what the imaging is suggesting is going to be helpful for that, but then also helps us look towards prognostic studies in the future as well. So yeah, very good. Thanks very much for doing this. I am looking for some questions for you, and
there haven't been any question, put so far. So in the meantime, I'm going to ask you a quick one, David. So I presume this dog had surgery, and the disc material was found at surgery, isn't it? That's they all had surgical confirmation, or
Sorry, say that again. Sorry.
They had surgery.
Yes. So yeah, all dogs had surgery, and all dogs needed a durotomy to remove the material, the intradural material. Yeah.
And was there any description of where the material was? Was there some that was extradural?
Yeah.
As well, or it was purely intradural?
Yeah, that's a good question. So from the 7 cases, 6 of them, they were purely intradural disc material. And then in one case, the neurologist reported that it was some mild amount, a small amount of hemorrhage extradural, but the disc material, so the disc herniation, was also intradural, if that makes sense.
And when it's intradural, I presume it's difficult because it's more the surgeon and you only get it secondhand. Could they see, obviously, the rupture of the dura when they open the surgery, when they, open the canal, and or did they have to do the durotomy to find the disc in this case?
Yes.
Was there anything?
Yeah. So I'm not entirely sure about all the cases, but the feeling that I got from all the neurologists is that they needed to open the dura to see it, basically. So they couldn't see it or feel it just by microscopically. If that makes sense.
It gives us time for a few questions to come up, so I'm going to put it on. Simon, I'll let you...
Okay, yeah, Marta is tuned in, and she's asking, how could you explain the different extent of hemorrhage in these cases?
The different extent of hemorrhage, like extradural hemorrhage, or?
I'm not sure. There doesn't seem to be any further part of that question.
So
I'm not really sure whether Marta means extradural or whether there's
intradural. Yeah.
Yeah.
So I guess if I got the question right, so if for example there is some intradural hemorrhage, I think the surgeons, and again this I'm not sure because I'm not a neurosurgeon, but I guess there would be a different appearance of the material. That's as far as I can answer this question. Obviously, to know exactly the nature of the intradural material, it should be sent to histopathology to see if it's just this or there's mix of hemorrhage or.
So maybe if I could ask a slightly related question is
Yeah.
Were some of your discs hemorrhage free?
Yeah, so most of them, no, 6 of them, the neurologists didn't report any extradural or extradural or intradural hemorrhage.
Okay.
It was just that specific case that had some extradural hemorrhage, which actually was the dog that died because he deteriorated overnight. So yeah.
And I know that this study obviously was primarily focused on T2 weighted sequence. You did some other sequences across the patients.
Yeah.
Did you find one, if you were looking back now at the study, did you find one that was consistently better than another? What would your recommendations be moving forward if we were going to look at this? If T2 weighted imaging wasn't that helpful, or you still were left being uncertain, where would you go with this?
So I would definitely run a gradient echo, and if it's still some doubts, then because of the literature that we have, I would definitely give some contrast, because, as I said during the presentation, it is reported that green enhancement is quite common in this type of herniations.
Yeah. Okay. Excellent. Thank you. I've got another question for Jonathan Hughes. Do you think the Y sign is commonly seen in both the sagittal and dorsal plane sequences?
Yeah, that's an interesting question actually, because I ask myself that just because we didn't see Y sign, so in all the dogs that we saw Y sign on the sagittal plane, but not that wasn't correlated with the dorsal plane. So the answer would be it's not correlated with both planes, and I cannot answer why, but yeah, there is no correlation. So in some dogs we saw it in both planes, but in the majority of them we just saw them in the sagittal plane.
In sagittal.
Yeah.
So that would be the one that you'd rely on the most.
I would say so. Yeah, I would say so. Excellent. When you see it on dorsal, or when we saw it on dorsal, it was, in my opinion, it was clearer than in sagittal, but we see it mostly on sagittal.
Question from Leandro Romano. What was the average age of the patients?
Oh, that's a good question. To be honest, I don't remember exactly the average, but they were not too young. They were not old. They were like middle age. I think the average of the median was 6 or 7. So.
And they mostly chondrodystrophic?
No, actually not. So we thought we were gonna have like overrepresentation of DAXs, but I think it's 3 DAXs or 3 or 4 DAXs in total. But I mean, it's a very small population of dogs. So, but we expected to have like almost most of them to be Dachshunds, but no.
Yeah, I just got the paper in front of me. You're right. You have 4 dachshunds, and
Yeah.
so excellent memory. You have a 14-year-old, 3 11-year-olds, a 5-year-old, a 9-year-old, and a 4-year-old.
Thank you, Simon.
Facebook quiz. Throw it out right now. What is the average age there? Go.
Last question. I apologize for any of you that ask surgery question, but I'm sure you understand. Obviously, Davide didn't do the surgery, did an imaging study, so I apologize if we're not covering the surgery and what was fine and so on. But there is a last imaging question that I think is relevant. And I was going to ask you the use of 3D thin slice, like 3D cis, obviously depending on the machine you got. Did any of them at this kind of sequence?
Yeah, any of the cases that we have, you mean?
Yeah.
Yeah. So, yeah, thankfully I didn't do any surgery, which was good for the dogs. But so we tend to do at Willows. We tend to do 3D sequence in most of our spines, and in this cases, so they were not all from Willows. So I think there are 2 or 3 from Willows, and 2 of them we had some 3D sequences. The other ones we don't. But I forgot to say in the previous question that would be a sequence that I would also recommend, because you can see much better and with much more detail.
It's a bit the same with the constructive myelopathy and or the arachnoid cyst. You make it much more easier to actually identify. I think we're going to have to draw to a close. Simon, I will leave you the last word.
Thanks, Laurent. Thank you very much, David, for an excellent presentation reviewing the publication. Anyone who hasn't read it should go to Frontiers. We can post a link if it's not already posted there, so you can read this great study. Thank you very much for this and for giving up your time in the evening. Thanks, Ennis, for being there as his mentor, and for giving us a look at your lovely-looking dog there. It's great. Thanks again to Hallmark Advanced Veterinary Imaging for sponsoring this session. The next webinar will be in the first week of December, an early Christmas present. Yes, we are nearly at Christmas. An early Christmas present for you all. Anyone who is interested, we do have a speaker actually for December, and we'll post that information soon. But anyone who is interested in presenting in the new year, if you've recently published work, if your work is going to be published soon, please get in touch with us. We'd love to give you this platform.